Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even few are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.
Good afternoon and welcome to VITALS. I'm John Langell, president of Northeast Ohio Medical University, and it's my pleasure to welcome you to the VITALS Forum, where we discuss some of the biggest issues in healthcare and how they're affecting our communities. VITALS is intended as an open forum dialogue where we hear from the nation's most cutting-edge leaders who are using the VITALS tools, value, innovation, technology, advocacy, leadership, and service to implement change. Today, we're very fortunate to welcome Nancy Schlichting. Nancy is the retired Chief Executive Officer of Henry Ford Health System, a nationally recognized $5.7 billion healthcare organization. She is credited with leading the health system through a dramatic financial turnaround and for award-winning patient safety, customer service, and diversity initiatives. Among her many accomplishments and recognitions, Ms. Schlichting was honored as one of the 100 most influential people in healthcare by Modern Healthcare magazine 8 separate times. She was also named to the top 25 women in healthcare by Modern Healthcare 4 times. Her other awards, including the NCHL Gail A. Warden Leadership Excellence Award, the American College of Healthcare Executives Senior Level Healthcare Executive Regents Award, and recognition by Becker's Hospital Review as one of the 40 smartest people in healthcare. Nancy is also a fellow of the American College of Healthcare Executives and a member of the International Women's Forum. Notably, in the fall of 2015, she was appointed by President Obama to chair the Commission on Care. She is also an acclaimed author of the book, Unconventional Leadership. She is a highly regarded expert and an accomplished speaker on strategic leadership, quality, patient and family-centered care, and diversity. And I'm also pleased to share that in the next few weeks, Nancy will be inducted into the American College of Healthcare Executives Modern Healthcare Hall of Fame. This will be on March 27th. Ms. Schlichting, welcome, and the floor is yours.
Thank you so much, John. It's a great honor and pleasure to be with you today. And I want to also thank Dr. Steve Schmidt, who I've known for 40 years, for inviting me to be a VITALS speaker, and Rod Ingram, Diana Dillon, and James Moore for all of their technical support, which has allowed me to speak with you from my home in California today. A little bit about my background. I actually grew up in Akron, Ohio. So I'm a native Buckeye and love the Northeastern Ohio area. I've spent 50 plus years in healthcare, starting at age 15 when I was a volunteer at Akron City Hospital, and really did start on the front lines of healthcare. So I've seen it from the very front lines to the executive suite over the course of my career. I was a nurse aide, I was a cancer outreach coordinator, and a switchboard operator, which most people don't know what that is anymore. But it gave me a really wonderful window into the entire hospital environment. I've had very diverse experiences working in 25 hospitals and 4 health systems, including 10 years at Summa Health in Akron. But my career really culminated in 1998 when I joined the Henry Ford Health System in Detroit. I spent a few years as Chief Operating Officer and then 14 years as CEO. And what was really important about my experience in Detroit is it's a very tough market, as you all probably know. And we had a very unique model of healthcare, which I think really allowed us to really touch lives in a way and serve our community in a way that was quite unique. We had a large medical group. Our physicians were employed by the health system. And that was modeled after the Mayo Clinic model, when Henry Ford actually founded the hospital in 1915. In addition, we owned an insurance company, a health plan that had almost 1 million lives. We had a very large ambulatory network that actually started in the mid-70s. And we had a whole retail health division where we had retail pharmacies, dialysis centers, hospice, home care, a variety of programs that really allowed us to do some different kinds of things within our communities. I think, as we all know, healthcare has experienced, without a doubt, perhaps ever, the most challenging period of time over the last 2 years. The level of risk that our healthcare teams have taken, the fear that they and their families have experienced, and the stress that they've been under is unparalleled. And sadly, we've lost tens of thousands of healthcare workers, not only in our country, but around the globe. The uncertainty and disappointment have been significant too during the course of the last 2 years, at times thinking we were coming through it, and then a variant would appear, and healthcare went through a real slump. And I think it has accounted for a lot of the great resignation we've seen, and a lot of people actually leaving the field. So it's a very important time for us. And perhaps most troubling has been the fact that healthcare workers went from being heroes in our country to now facing sometimes anger and criticism from patients, employees, and even physicians around vaccine mandates, as well as mask requirements. It's a really tough time, I think, in our field. And that's why I think it's important for our discussion today to focus on how we take what we've learned and look at the plus side, look at the things that have come out of this that perhaps can be incredibly positive. Two that immediately come to mind for me is the advances we've made in telehealth over the last 2 years, which has allowed many patients to have better access, frankly, than they had before, and has allowed for a level of efficiency in care that I think is something we need to really grab hold of and make sure that we're utilizing in the years ahead. The other thing that has come through very clearly, and part of it has been the focus on racial injustice in this country, is the fact that we have enormous inequities in healthcare. And it's so critical that we bring our innovative thinking to how we address those and improve access, improve the experiences that people have from all walks of life and all life experiences themselves. One of the reasons I think I might have been asked to speak today is that my time in Detroit may be helpful as each of you navigate your careers and your work during these unprecedented times. Just to give you a sense of what it was like in Detroit from 1998 to 2017, we had an incredibly difficult time, as a community. In a very disappointed way, our mayor ended up in jail for fraud. We had 2 major corporate bankruptcies with General Motors and Chrysler, 30% reduction in our population during a 10-year period. And during the financial crisis, we were the only state in the country that did not grow. We also lost 1 million jobs, and the unemployment rate in Detroit was over 25%. Finally, our city went bankrupt. It was the largest municipal bankruptcy in the country, in our history. So you might ask, how did we survive all this? And how did we even thrive against this? Because just to give you the bottom line, we went from a $2 billion organization to a $6 billion organization during this time. And we also won the Baldrige Award, the National Quality Award, for the highest levels of quality and service and improvement in all aspects of our operations in 2011. One of the things that I really focused a lot on was innovation, because we had a history of innovation. Henry Ford himself, one of the great innovators in our history, started the hospital in 1915, and at that time believed that it should be the best hospital ever and have very different kinds of thinking and models in place. So what we did is always focus on multidisciplinary work, bringing teams of people from all walks of life together to solve problems. And when we did that, we found that, the diversity in the thinking, as well as the diversity in our employees and our physicians, allowed us to find things that we never would have found otherwise. Because my belief is when you bring diverse groups of people together, there's a lot of gold in those intersections of thinking and experiences. We also did things that were a little crazy, like collaborate with our competitors. And my thinking was that we were there for the community. We were all founded to serve the community. So it was critical that we would find that common ground. So for years, we would have all the CEOs of the major health systems come together every couple of months and focus on things that we could do together. And one of the things we did, which was really fun, is actually focus on how we could incentivize our employees to live in Detroit. So we set up a program with a foundation. We gave our employees money to buy homes, to rent apartments, and to really change the dynamic within the city and create much more positive momentum. We also started an innovation institute, which allowed all of our employees to participate in their new ideas and ways of innovating to improve healthcare. We've actually started several companies out of this innovation institute. We've had hundreds of projects from frontline employees, including a nurse who decided that there was a little tool that had to be developed to open surgical trays to avoid hand injuries. Lots of fun things that are really exciting. In fact, we designed our own patient gown called the Model G, which I think you get the humor in that. We also decided it was very important to embrace disruption. I knew that we couldn't be, the same as everyone else, because a lot of people were afraid to come to Detroit for their care and preferred the suburbs. And it was really important that we had to be better than everyone else. So one of the ways we did that was listening to the people that had sometimes really novel ideas, including our chair of urology, who came to me many years ago and said, Nancy, I think I can devise, using a robot, a new approach to prostate cancer surgery. So Henry Ford, literally partnering with Intuitive and the Da Vinci robot, was the first hospital in the country to do the robotic procedure for prostate cancer. And Dr. Menon really allowed us to get our mojo back because, in fact, for years, people wouldn't come downtown for care, but we got patients from 25 countries of the world and all 50 states to come to Henry Ford for that procedure. And it allowed others to see that everything's possible, that if we believe we can do it, we can do it. So building a great culture was a very foundational element of our, not only our turnaround, but also how we began to thrive as an organization. And I've always believed as a leader that you have to focus on people. Healthcare is a people, team-focused, area of work in our society. It's so important that we take care of the people that are taking care of people. And I always believed my fundamental job as a CEO is to create a great environment for people to reach their full potential. And that meant everyone. That meant a housekeeper. That meant a physician. That meant our patients. And that meant the community. So everything we did was with that lens in mind. We also worked to make a large organization feel small. So one of the ways we did that is, anybody could email me with any problem at any time. And what was interesting about that was the fact that they knew they had that access, but they didn't have, no one ever abused it. Typically people can solve problems with their own work area, their own manager, but sometimes things didn't get done the way they should. And when they knew they could get a hold of me, and I responded immediately because I got up every day about 5 o'clock to answer all those emails, it made a difference in the organization. They knew that there was somebody at the top that cared and somebody who was paying attention to what they were concerned about. So we really led the organization based on our values. We drove decision-making based on our values. And those values included, obviously, honesty and openness. It included transparency. When things went wrong, when we had problems, we talked about them. We didn't hide them. And we always communicated with our employees and physicians first. There was never a time when something came out in the newspaper or was made public before our people knew. And that was an important level of trust that they had, I think, in the organization. My favorite word in my vocabulary was yes. Yes, we will look at that. Yes, we will respond to that. When people are faced with a lot of no's, they get discouraged, and frankly, they do not bring their ideas forward. And we always encourage people to speak up and tell us when things were bad. If there was a quality issue, which occasionally we found, we addressed it, and we also often made it public, because there were times when a group of patients would be impacted by that, and we made it public to make sure that we could respond in the way that we needed to. One of the questions we always asked every leader who was interviewing for a job at Henry Ford is, what do you stand for as a leader? Because it is important that we have a purpose in these roles. Leadership is a privilege. And so it's really important that we take advantage of thinking very clearly about why we're doing this work. And for me, the core of my leadership was about diversity and community. I always felt that allowing every person to feel valued in the organization and recognizing that every job is important and every job is hard was really a critical message, I think, that people could hear from me. In addition, community is the reason we exist. And oftentimes, healthcare organizations have become so corporatized that they're really kind of out of touch with the needs of a community. So it's really important that we get in touch and that we are really connected. I would also add that, as a medical school, all physicians are leaders. So even those of you who may not have leadership titles or don't think you want to go into any administrative roles, it's really important that you recognize that everyone watches you as a physician because you are leaders. You're leaders in your team, and the behaviors you have are incredibly important because they're often modeled, both the good, the bad, and the ugly. So really important that you think about your purpose as being a physician and being a leader. Another thing that we tried to do was constantly reframe the problems, because oftentimes when you focus on problems, you become a victim and you start to blame others for the problems. And frankly, that's not where innovation and good solutions come from. So we had a mentality that we were in a no blame, no victim kind of approach. We were on offense, not defense. We were always trying to anticipate and get ahead of problems as opposed to waiting for them to happen and be reactive to them. We took a lot of risk. We opened a brand new hospital in 2009 in the middle of the financial crisis. And, frankly, one of the weird things I did is I hired a guy who had never run a hospital, had come from the hospitality industry, the Ritz-Carlton, to be our CEO. And the reason I did that is, frankly, I wanted us to succeed. And I wasn't sure if a traditionalist came in that we would be able to compete in the market, which was very competitive that we were in. So taking risk was really important. Larry Page from Google has a saying that I've always liked. It says, always work on something uncomfortably exciting. And I think that's a very important part of an organization's life, because when you do that, everybody gets engaged and they come forward with their ideas, and they actually made me look really smart. And believe me, it's a team sport. I did nothing by myself. And it was also important that we were both strategic and opportunistic. It's important to always plan, but sometimes you can plan too much and not see some of the opportunities that may actually be right in front of you. Our new hospital would never have been built if we didn't take advantage of an opportunity that allowed the state to approve that project at a very, not necessarily the most opportune time. But we seized the moment, and I think, it's proven that was a good decision. Always lead with quality in your work. The reason we got on the Baldrige journey is, frankly, I didn't think the organization was that great, virtually in every aspect. So Baldrige allowed us to improve everything that we did. It also really resonated with our clinicians as well as our frontline staff, because, when you lead with quality, that's really what people care about. And often quality problems are not the result of individual error. It's a result of a system problem that really doesn't get solved. So by always focusing on that, it allowed us, I think, to really regain our footing and, frankly, just reach levels of performance that no one thought we could. It's also important to inspire people and be positive. Frankly, all of us are on stage every day when we go to work, and people watch us. And I always used to tell a story that when I worked in Columbus, Ohio, one day I came into work and someone said, "Well, I saw you, Nancy, over the weekend." I said, "Where?" They said, "In your car." I said, "Really?" Was I singing? Was I speeding? It's always, really amazing what people notice. And so I think it's very important that we stay positive, have our game face on when we come to work every day, do the best job we can, even when we're facing difficult situations at home. and really helping people, again, say yes more than no. Someone described the culture at Henry Ford when I first joined as 1,000 points of veto. Not inspiring, I mean, if everybody can say no and nothing gets done, not good. And I'm so happy that when I retired, we were known as "We're Henry Ford, we can." So being confident, believing in ourselves, believing in everyone that we had on our team was really important. And it was also important to create the future we wanted to see, because frankly, oftentimes people say, well, what's the future going to be? Well, my attitude is we make that future. We create it. And if you believe you can do it, just like Olympic athletes, there's always that stretch that's out there that we all can find, and we can do a lot better than we think we may be able to do. And then finally, one of the things I preached my whole career is, in healthcare, we don't take very good care of ourselves. And it's really important that we do. I took every day of vacation for my entire career, and I encouraged everyone to do the same. And oftentimes spouses would come up to me and say, Nancy, thank God you told my husband, who's a physician who works ridiculous hours, to take some time off, because that's helped our family. And that is the truth. We all need time off. We're not invincible. It's not a badge of honor to say, I never take time off. That's in fact kind of stupid. So I think it's really important that we take our vacation, that we are available for the important events in our lives, because they're the memories we take with us. And that every day you do something for yourself, even if it's little. Right now it's maybe Wordle, but you do something for yourself every day, and make sure you are taking care of your health, nutrition, exercise, having your screenings, getting blood pressure checked, other lab work done. Do it, because you don't go through this life as a dress rehearsal. So I encourage all of you to do that. And now it is my real pleasure and honor to introduce Betty Lynn Fisher, who is a medical reporter and consumer columnist for the Akron Beacon Journal.
Hi, Nancy. Thanks so much for such wonderful tips. And I'll say right away that Nancy and I did not coordinate, but we both apparently really like maroon. So I am here in place of Monica Robbins with WKYC, the medical reporter. And I'm happy to report that, so Monica, for those of you that don't know, was recovering from her second brain cancer surgery. But she was at the end of this week going back to work. So we wish Monica well, and I'm sure she's got a lot of emails and a lot of things that she's got to dig out from as she gets adjusted again. So some of you have already started, throw in some questions for Nancy, and we will get to as many of them as we can. So I'm just going to start at the top. What specific personal leadership skills were most important in your success as CEO at Henry Ford?
I think probably courage was one, being, not having fear, because, when I had the experience actually of being in Akron in the early 80s, when we had a major recession and our unemployment rate was around 12%. And we saw, the industrial changes in Akron during my time there. And I think that actually prepared me in a very important way for my time in Detroit, because I was not afraid of it. I thought there were things we could do. And I think the other is just loving doctors. It's interesting. Many of my colleagues, when I hear them at meetings, they're complaining about physicians, and I think, what's wrong with you? Why would you do that? It's sort of like going out and complaining about your family. It just makes no sense to me. And I had the great benefit of working with a wonderful mentor, Al Gilbert, the CEO of Akron City Hospital and Summa Health System for many years. And he taught me about how to work really effectively and honestly and with care and love for the physicians in the organization. And those lessons stayed with me my entire career and were very helpful at Henry Ford.
How important is it to, speaking of that, how important is it to find a mentor? And at maybe different stages of your career, does that mentor change?
I've had several important mentors in my life, and some of them weren't the most positive mentors. I've learned as much from negative experiences as I have from positive. And I've also found, even in people that I didn't respect as much, that even those people had qualities or talents that I learned from. So I think, and sometimes you don't know, you don't walk up to someone and say, are you my mentor, or do you want to be my mentor? Sometimes you're just observing and learning from that observation, and bringing some of those lessons to your own career. But I think you can learn from everyone, actually. And I think being open to it and paying attention and observing with a lot of intentionality is really important. And I have learned from countless people. I've had a couple of really important mentors in my life, but I've learned from tons of people.
I was just actually in a meeting the other day where someone was saying, you shouldn't always necessarily look for a mentor that's older than you or ahead of you in your career, that even now you should look at mentors who are younger that can maybe teach you social media skills or maybe teach you something that you don't know.
That is so true. In fact, right now, at this point in my life, one of the real joys that I have is mentoring young people who are really young students at my alma maters and other organizations I've been a part of. And I learn a ton from them. And frankly, I love them. I mean, they are bringing a whole new set of experiences and perspectives and ways of thinking that I did not have. And I'm growing because of it.
Okay, next question. You were disruptive in addressing critical issues coined as the quadruple aim a decade before it was coined. Why does it seem like others aren't willing to take such risks to address these issues?
I wish I knew the answer to that question. Because to me, the reason I got into healthcare is that when I was very young, my mother was in the hospital, actually at Akron General Medical Center for a month. And in those days, this is back in the 60s, children were not allowed to visit. She had a lot of complications from her experience, which frankly, I'm not critical of. It's just the nature of what was wrong with her. But it taught me the importance of both, family-centered type care and service to patients, as well as, that quality is so important. And people assume you have good quality, and sometimes you don't. And I think, making sure that you focus on that very early, is really important. I mean, when you think of your own family receiving care in your organization, it puts it right up front for you, how critical that is. I mean, my father was a patient at Henry Ford for many, many years. And I think Henry Ford actually, saved his life a few times because, they were so focused on detection and quality. And it wasn't because it was me. That's how our doctors really approached their work. And our nurses were, so incredible. But when they know that you feel the same way as a leader about care as they do, it is amazing how much progress you can make in a short amount of time.
So one of the fun things about you having your connections here is old friends. So Dr. Jo Joseph Zarconi says, great to see you, Nancy. And he has a question for you. Hi,
Joe. I have to tell a quick story about Joe. Joe was a chief resident back in the day when I was at Akron City. And he was, I think, in the first class at what used to be NEOMED. So that's pretty cool.
Okay, so his question is, what do you think are the most effective antidotes to the current crisis of burnout, depression, and suicide within the health profession?
Well, it's an absolutely critical question. And I serve right now on the Duke University Health System Board. And so I am very close to this issue. And and maybe I'm nuts, but I really think people need time off. And I know that's hard. It's hard to figure out how to do it. But in talking with my Duke colleagues, they say the employees and physicians have plenty of time off to take. But I think there has to be a really strong focus on allowing people time to take it so that they, in fact, have a breather. I do not think if we don't allow people more time and really, time to reflect, time to heal, time to grieve, I don't think we're going to see much improvement in this. And I'd be really focused on innovation in that space, figuring out how even to bring some retirees back that potentially could fill in some areas where they still have their skills and competencies, and look for a way to relieve, the stress and chronic stress that we're seeing. In fact, my sister passed away just 6 weeks ago, and she had worked at Children's Healthcare in Atlanta, and I was speaking to the CEO there last week, and she shared with me that what's going on right now is not just stress or anxiety, it's being overwhelmed. I mean, not seeing your way out. And I think that's something we have to focus on. And there are not enough behavioral health resources, frankly, to address this, but we've got to bring everything we can to bear on it.
This might be along the same lines, but I'm going to ask it and see if you want to expand anymore. Doug Smith says, hi. In 2009, Henry Ford managed to have 0 deaths by suicide, a first in the country, and likely the impetus for the very important National Zero Suicide in Healthcare Initiative. What leadership steps were important in achieving that great work?
Well, thank you, Doug, for that question. And it is something I think, we were extremely proud to figure out that we could do it. And I will tell you a couple of interesting aspects of that story. One is that the chair of psychiatry at that time, he set this as a goal, and frankly, got a ton of pushback from his team. And I remember it was very much like our do no harm campaign that we started at Henry Ford, where we saw a 35% drop in harm events, and we wanted more. But, setting really bold goals is how you get there. And not being satisfied, frankly, with anything else. Because, is one suicide okay? It's not. It really is about 0. And what we learned in that process was that, the more connection you had with those patients and figuring out ways to provide, almost a blanket or, reaching out arms around them, that's how they felt they were supported. It was the isolation and the loneliness and being on their own, frankly, is where people can start thinking in a way that is not at all healthy and could lead to their own death. So it was really thinking through, how do we build a structure of connection that allowed patients to really feel that at any moment they had someone they could call. Or they had a way of reaching out and connecting with people that could help them.
Okay, next question. How has or will healthcare leadership change in response to the COVID pandemic?
It's so hard to know exactly, but I do think, my hope is that we change in a lot of ways. We get much more focused on our people because it's so clear that, if we don't, frankly, we may not have a health system. And we certainly aren't going to have enough people. But on the flip side, I would tell you, and I'm sure NEOMED knows it, we have seen an increase in people wanting to get into healthcare as a result of the pandemic, because much like when 9/11 happened, a lot of people joined the military to really be able to contribute in a meaningful way to what was going on. The same is true right now. So I think we need to seize that moment and make sure that as we bring people into healthcare, that we are really supporting them in a really perhaps very different way, giving them the tools that they need in order to handle the stress, as well as to really, feel good about the work that they do every day. So I think that's one. I think the other is that, frankly, we need to focus on, these inequities that we've seen in healthcare during the pandemic. Much better access. And really looking at and measuring, the challenges that we're seeing in terms of outcomes, so that we can improve the approach that we take to the care that we're delivering.
Great. Can you talk a little bit about the role that physicians played in the turnaround of Henry Ford?
Well, the physicians at Henry Ford were my partners, totally. Obviously, the whole organization was in many respects. But one of the things I did coming in and particularly dealing in a turnaround situation where we literally, just so you know how difficult it was, we had to lay off 15% of the employees at Henry Ford Hospital. We laid off 15% of our corporate employees and 10% of our medical group. So this was excruciating work and so difficult. But what I did is I reached out to a variety of groups. I had sort of 3 focus groups. I had the senior physicians that had been there a long time, that had wisdom and perspective that no one else had. So I had a group of them that advised me. I had the mid-career who, were going to be there, but also were perhaps a little discouraged. And then I had the new folks who had just come in, who had all kinds of ideas and energy. And I listened to all of them. And I had physicians, I changed the entire executive leadership structure to have all of the chairs of the departments that impacted the hospital. And they sat on the executive team, and they went through every meeting with every department where we discussed where we were going to cut the costs. So they were engaged in every bit of it. It was totally transparent. They saw what we were doing. They contributed and told us, where they thought we were wrong, and they were part of the decision. So that was a huge aspect, I think, of our success. And I think the doctors at Henry Ford knew that I really not only respected them, but I loved them. I used to use the L word, because it is important. I mean, these are tough jobs, and same was true with our nursing staff. And they have to know you really care about them.
Here's a question. What was the initial response when you hired a Ritz-Carlton hotel executive to be the CEO of the new Henry Ford Hospital?
It was mixed, I will tell you. And I didn't do it without the absolute endorsement of the CEO of our medical group. So Dr. Mark Kelly, who was the CEO at the time, I was getting pushback from all over the place, but I still thought I was on the right track. And so I went to Mark and I said, Mark, what do you think? He said, Nancy, if he can make the trains run on time, we'll handle the clinical side. So that's what we did. We surrounded him with the best nursing leadership, best physician leadership. And we had 2 years before the hospital opened where he learned so much and began to understand, how all this worked. But he also brought his outside thinking in, very different ideas about how we serve people and how we designed the hospital. So it was interesting. The really unique part is our competitors just thought this was great because they were going to seize the moment. And they had these ads on TV that said, we're not the Ritz-Carlton, we're a hospital. Well, guess what? After we opened and we had 99% customer service satisfaction and we were cash flow positive in 1 year, they all hired people from the Ritz-Carlton. It was great. I loved it.
How long did he stay?
He stayed 7 years.
Okay, good. Did Henry Ford find any ways to specifically encourage underrepresented minorities to find a career path into healthcare?
Absolutely, we did. We had programs called Career Quest where we were out in the schools and bringing people in, and had a lot of fun success stories of watching someone we had been engaged with from a young age to being a physician within the medical group. And we also built diversity into every single leadership development program. And we had 4 leadership academies. We had a frontline, kind of new leader academy. We had a mid-career, we had an advanced leadership academy, and we had a physician leadership academy. And frankly, even in the toughest of times when we were looking at cost cutting, we never cut those programs because they were so important. We also measured our success. We looked at the diversity of each groups. We looked at the career path. We reported to our board about these, results and how we were doing and really engaging. And frankly, the best thing that I can tell you is when I was going to retire, the board asked me to help them find my successor, which is unusual. Typically, the CEO kind of gets pushed aside, but in this case, they asked me if I would help. And I found an individual, African-American gentleman from Oakland, California. Getting him to move to Michigan was not a small thing. But he had actually done things that we needed. He worked in a community where he ran a public health system. He succeeded against the odds. He had courage. And frankly, he has done an extraordinary job during COVID. Helping the organization through it. And, that was what I was looking for. I was looking for someone who understood and appreciated our community. And I was looking for someone who was fearless and who could, in fact, manage through really difficult times, because I knew they would be there at some point. And in fact, Wright Lassiter, who is my successor, is right now the chair of the American Hospital Association. So, he has really shown his leadership in a very positive way.
Great. Next question. The important role that excellent health systems play in the revitalization of large cities is near and dear to us in Northeast Ohio. What parallels do you see with Detroit?
Well, there's a tremendous parallel. In fact, I learned quite a bit about that aspect of really engaging in the community when I was in Akron, because, we were looking at ways that we could, obviously expand the campus, but also partner with the university and do things that I think were, really forward thinking for their time. And in Detroit, we started buying property. We actually have 100 acres next to our downtown campus at Henry Ford Hospital in Detroit. We've had Cardinal Health came in and built a distribution center there. We have partnered with the Motown Museum to expand their wonderful campus. We just opened a new cancer center there. We are looking at housing. They're looking at all types of ways that entire area can just be an economic positive for the community. And they've just partnered with Michigan State University in their medical school. So they're going to be building a research facility right in that area as well. So for Detroit, it was so important that we demonstrated that it was a partnership model, not just, expansion of our campus, but it was really, how do we think about the needs of the community? How do we, revitalize in so many aspects, partner with the Museum of Arts, the Symphony, the Motown Museum, Wayne State University, the DMC, all the various partners in our area. And it was fun. We had really some great partnerships.
There's several questions that people have regarding leadership, so I'll try to get to a few of them. First, what is the most catastrophic leadership outcome you experienced in your career, and what did you learn from that experience?
I'm not sure there was a catastrophic outcome, although I would tell you that every time we were in, financial trouble, especially in Detroit, I had to close 3 hospitals during my time. And one of them, we were not able to save the jobs, and the other 2 we did. It is a catastrophe when you're affecting so many people and their livelihood and their families. It's terrible. And the reverse is also true. When you're able to figure out solutions to helping them survive, particularly during this economic crisis we had in Detroit and across the country, but Detroit was really severely impacted. I had an employee one day who came up to me and grabbed my hand and said, "Nancy, I want to thank you for saving my house." And, that's what we do in leadership. Our decisions affect people in their lives. So those were the kind of things that always had just enormous impact on me. And I worked so hard to figure out ways with our teams, our HR teams, everybody, how can we solve this differently? How can we help people sustain their jobs? And at times, I had a housekeeper that came up to me. She hadn't had a raise in 3 years. And she said, "Nancy, I really need more money." I said, "I understand, but I have been trading off raises for jobs. I've been trying to save the jobs." And when I explained that to her, she said, "I get it. I understand." So as soon as we had the financial resources to increase pay, we did. But it was, these are the kind of things that I think people need to talk about in leadership a lot more.
Jennifer Bacon says, "I love that you took a risk on a non-traditional CEO from a different industry. What tips do you have for physician leaders who aspire to CEO and other executive roles as they create their personal brand, particularly since not all health systems think of physicians as potential executive leaders?"
Well, that's an interesting question, because we are seeing way more physicians in CEO roles than we used to. So I think it's a very open opportunity for physicians to lead, in a variety of ways. But one of the pieces of advice I always give physicians who aspire is, first of all, get the right education, because running this business is very different than having your clinical training. It's a big business. Healthcare is a big business. You need to understand the finance and the accounting and the marketing and the organizational elements, the HR. You really need to get grounded in that. So it's very worthwhile to get more education around that. The other is, I always love when physicians really lead with quality, because if they understand the quality system in the organization, they have a much greater opportunity to have really big impact, across the board. Quality is a cost reducer. When we started our Baldrige journey, we were spending $50 million a year on malpractice expense. When we completed it, we were spending 15, and the organization had doubled in size by that time. So, when you think about it, leading with quality it helps you understand the financial ramifications. It helps you really deliver on the promise that our patients and their families expect from us. And you figure out the analytics. You look at new innovative ways of helping providers to deliver care more efficiently and effectively. So I would highly recommend that as a starting point.
Do you have any, one person's asking if you have any specific recommendations for young clinicians who aspire to be leaders in their healthcare settings?
Well, there's so many ways to lead. Get involved in projects. Volunteer, your services to be more engaged. Start partnering with your nurse colleagues on things. There's lots of ways you can get involved, and frankly, serving on committees. Just a variety of ways that you'll begin learning, and just share with some of your executive colleagues that you have that interest, because we were always looking for the young professionals who really had those aspirations, and that's how we got them in the leadership academies, and and some of them would go off and get an MBA, and we paid attention to those individuals because they were doing some really important things to advance their careers.
I told you there's a lot of leadership questions, so here's another one. How can leaders refine skills to prepare their teams to become anticipatory versus reactionary in the medical education environment? It's a shift in mindset and culture in some places.
It's hard. I mean, I would acknowledge that that's not easy, but I think it's sort of how you frame questions and opportunities. If you think from a medical education standpoint, what are the problems that need to be solved? How can you engage people in that process? And how can you share data, frankly, that convinces them that this is important? I've seen that so often with physicians that, kind of poo-pooed even quality work. And then once they saw the data, it was something they couldn't ignore. So I think being data-driven is really important. One of the things, I actually ran strategic planning at Akron City Hospital back in the early 80s, and they never had strategic planning. And I decided my goal was to make everyone a strategic planner. So I hired this guy who was an analytics guy he actually went to University of North Carolina. I went to Duke, so that was a little bit of a conflict, but we brought him in, and he did a fantastic job putting together information to share with people. We went, dog and pony shows all over the hospital. And by the time we were done, we had nurses who were getting intelligence from their competitors about, what was happening with market share. I mean, it's incredible when you share information, how you start to see the opportunities and people grab it and they look at it differently and they start sharing it. So the more you are intentional about that, I think the better the results will be.
The next question is for you as an author. So much has happened since you wrote Unconventional Leadership 6 years ago. What would you change or add if you were writing it today? And when is volume 2 coming out?
Well, what's interesting about that is that, not a lot has changed other than the pandemic. But I think the lessons that, I talked about today, many of the things we went through in Detroit, the reason I wrote the book, for those who are not aware, it was my personal journey as a gay female. And it was also very important to talk about Detroit and what we did at Henry Ford. And, I think those lessons still apply today in a big way. In fact, I've been asked many times recently, what would you suggest that we do? Because it's about a critical situation that you're trying to manage through, and you have to have clarity. You have to have focus. You have to have transparency about what you're doing. You have to engage people in a positive way. And I think those things still work. But I also think that, as I mentioned earlier, I think the need to focus on the health and the time off, and, being creative about, sabbaticals, maybe mini sabbaticals for people. And I also think if we treat people really well right now, even if some of them leave the professions for a while, they may come back. Because healthcare, has an incredible draw, a sense of purpose and meaning that many other professions don't have. And I think it's frankly why, many of us have stayed in it so long. And I apologize for my dog. She's been very quiet, but she may be stopping now. I don't know.
Brandon Petrovich asks, in her book, In Shock, Dr. Rana, I'm going to say this wrong, sorry. Dr. Rana Audish discusses her experience as both an intensivist and critically ill patient at Henry Ford Health System. She highlights how even excellent health systems can fail to show empathy and truly see patients as the people that they are. How did you work to enhance patient-centered care in your time at Henry Ford?
Well, you know what I'm so proud of? I know Rana very well, and we hired her, to actually engage in terms of the patient experience and working with our physicians and across the organization, in addition to her own clinical responsibilities. But that made me so proud that she would write that book, and we thought it was great because that openness about the things we did wrong, frankly, in her care, and how she viewed it as a physician was powerful. And to me, that's what a culture of being able to speak up, and because we wanted her to write that book, and she has made such an impact across the country. She has spoken everywhere, and I think is really changing healthcare in an incredibly important way.
Okay. How did the Flint water crisis impact your system and the city of Detroit? And what can we learn from this public health mishap?
Well, I will tell you that, it's talk about catastrophic. That was catastrophic for Flint, for our state. And frankly, there are so many lessons to be learned there. But one of the things I'm proud of is that the physician that, was the strong, courageous physician, actually is the wife of one of our doctors at Henry Ford. So I have gotten to know her, and she is remarkable. I think it demonstrates, again, many of the things I've already said about the critical nature of leadership, and sometimes speaking up when people do not want to hear what you have to say. And she is still doing that. I mean, she is a powerful leader in our state. She is well respected, and I think has made an enormous difference in that community. As we are more focused in Detroit than Flint, although we actually we bought a health plan in Flint around the same time that this was happening, and so we became more engaged through our health plan in what we could do and contribute both financially and in other ways to improving, the health of that community.
You touched on this a little bit, but I'm going to throw this out there in case there's more that you want to add. Someone asked, can you talk about issues of diversity, equity, and inclusion in healthcare leadership?
Well, diversity, equity, inclusion are, in my way of looking at the world, it is who we are. And particularly in communities like, Akron, Cleveland, Detroit. I mean, not every community has the level of diversity that we do in these communities, but it defines us. And, what I loved about it for our organization was that we literally put a ribbon of diversity, equity, and inclusion around all of our strategic pillars. We had 7 strategic pillars in Henry Ford: people, quality, service, growth, academics, community, and then finance. And finance was purposefully at the end, and people were first. And each one of those pillars, you could put a diversity lens on, an equity lens, because everything we started to do, whether it was marketing to the community, or it was quality, or it was how we serve people, or how we could grow, it tied directly into that. Because, being a diverse community, if you are the place that people want to go, you grow. And you grow against others that are not as sensitive or not as knowledgeable, frankly, about the community. And we put resource groups together that allowed us to learn, because our employees knew way more than typically all of our leaders did about the issues affecting their community. And, it was terrific because we'd have major presentations. We had diversity events every year. And we were so lucky in Detroit because we had an African-American museum. We had a Holocaust museum. We had a Arab American museum. We had Mexican Town. We had so many wonderful venues where we brought people together. We gave awards for diversity champions. We just made it part of who we were. And, and I led it. I did not delegate it to the chief diversity officer, although we had one. But I didn't think that was her job. It was the job of all of our leaders to engage. And one of the things I'm really proud of at Henry Ford is that all of our leaders, including our physician leaders, were engaged in the community in so many different ways, serving on boards, being involved with a variety of initiatives. And that allowed us to understand so much better what we needed.
Great. Well, thank you so much for taking the time and sharing so many insights. I have one more question before I'm going to send it back to Dr. Langell. Can you describe what the Model G gown was?
Well, we actually partnered with the College for Creative Studies, who were design students. And they came in and looked at our gown, and they shook their heads, said, "Are you kidding me?" The thing in the back where the trunk shows, as they say. But it basically has snaps. It was redesigned completely. It's much better fabric. It's more comfortable. So it's pretty cool. I wish I had one here to show you. I used to have a little doll that had the gown on it, but I don't have it handy today.
Is it used in other places?
Yes, it has been used in other, and Medline produces it. So it can be bought by any health system.
That's great. Well, thank you so much. I'm going to send it back to Dr. Langell.
Thank you.
Thank you very much, Nancy. That was an amazing discussion. And thank you for sharing all the great impact your leadership has had on the communities that you served. An incredible career.
It's my pleasure.
Betty, thank you as always for your outstanding moderation. Ladies and gentlemen, I ask that you please join us for the next VITALS Forum on April 7th, when we will hold our first combined in-person and virtual VITALS program. We'll be welcoming Dr. Donald Malone, one of NEOMED's transformational leaders, a College of Medicine class of 1985 graduate, and the president for the Cleveland Clinic, Ohio Hospitals, and Family Health Centers. Until then, stay healthy and stay engaged.
Health outcomes. Changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even few are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.